Hey, Wellness Warriors, welcome to the Wellness Revolution. I'm your host, Dr. Milan Riobe, and today we're tackling the topic of adrenal stress and fatigue, the central issues around burnout. So, we're going to be exploring adrenal conditions that are recognized by the mainstream model, and unfortunately, more importantly, the ones that are not recognized by the mainstream model. We'll talk about why they're not recognized and how you can determine whether or not you have these conditions and how you can begin to treat them and rebalance yourself to recharge and rewire your nervous system. So if your mind won't shut off, but your body just wants to crawl into a corner and go into a coma, this episode's for you. Too often I see very young clients coming into the office just absolutely wiped out. They're doing everything they possibly can to maintain their health. They're sleeping, they're eating right, they're exercising, they're doing all the things. And yet they feel like dish rags. They walk in exhausted with brain fog, they can't focus, they don't know how they're going to keep up at work or with their families. And almost universally, aside from some other things that we identify, the one thing that is very consistent with all of these clients is that they have adrenal fatigue. Adrenal fatigue is not something you're going to find in your blood work. In fact, it's extremely rare that we find signs of an adrenal disorder in blood work. The reason for that is because blood work is often not sensitive enough to find certain conditions. And this is one of the main reasons that our mainstream model is so slow to recognize existing conditions until sometimes decades. A really great example of that is SIBO, or small intestinal bacterial overgrowth. This is a condition that, of course, has always existed. However, there's been an explosion of cases as chronic stress and toxins have really overwhelmed our society. Mainstream medicine was very reluctant to admit that this condition existed. In fact, they resisted for more than 2 decades, despite the clinical picture being very consistent that there was something going on in the small intestine. It wasn't until finally January of 2024 that it was formally recognized as a medical condition. We learned in medical school that it was essentially impossible for the small intestine to become infected unless something from the outside stabbed the small intestine. For example, if you got stabbed in the abdomen, God forbid, or if we stabbed you with a scalpel while you were having surgery. Those were about the only two ways that it was thought that the small intestine could possibly get infected. And we could not have been any more wrong. In fact, the small intestine is infected in 70% of the US population based on the latest studies. And yet it took mainstream medicine over 2 decades to admit that the condition existed. And it's not because necessarily that we're stubborn, right? Although we kind of are. But it was more because we don't look at the small intestine. We really don't have any tests to look into the small intestine for infections. The closest thing we can do is a colonoscopy, but it doesn't get into the small intestine, or we can do an upper endoscopy that also doesn't go into the small intestine. CAT scans don't show infections, MRIs don't show infections, so it's really hard to see. And this was one of the reasons mainstream medicine resisted SIBO. The other reason is because the test that was used to diagnose SIBO was thought of as a fringe test that didn't have any validity. Now it's accepted as the gold standard to diagnose and treat SIBO. It's a breath test. And so for all of those reasons, it took seemingly forever for mainstream medicine to admit that SIBO existed. We're in the same boat with adrenal fatigue. Because blood work doesn't show it, and because there really is no other way that mainstream medicine recognizes as legitimate to find it, we deny that it exists. But it's very real and it very much exists. And you have to look for it in ways that are not recognized by the mainstream model, but very much recognized by the integrative and functional medicine model. And we'll talk about that later on in the podcast. So just because mainstream medicine doesn't recognize something or admit something doesn't mean that it's not real. Adrenal fatigue is very much a real condition. There are 3 stages, one that we call adrenal stress, the other that we call adrenal stress and fatigue, which is a mixed type, and then there's the third type that we call adrenal fatigue. We owe a lot of the pioneering work on adrenal fatigue to Dr. Hans Selye, who formulated his theories about what he called the general adaptation syndrome. The adrenal system consists of two glands that are really tiny, and they're just above our kidneys on both sides, and they make critical hormones that we use for our fight, flight, and freeze reaction, which are adaptations to stressors. So when our body perceives a stress, so we either see something or we hear something that startles us that could be perceived as a threat, immediately that signal goes up to our brain, and then our brain initiates all of the fight or flight responses through sections of our brain we call the amygdala and the hypothalamic axis, which then triggers the sympathetic nervous system in this case, which is the fight or flight system that then immediately sends the signal down to release the stress hormones so that we can run or fight or, in some cases, freeze, which isn't always to our benefit. Those hormones consist of initially adrenaline, followed by cortisol. Those two hormones are the main stress hormones. Adrenaline being very fleeting, it lasts for maybe a minute or so, and then cortisol takes over for as long as is necessary. And therein lies the problem. The problem is twofold. One is that our brain doesn't always understand levels of stress. And so anything we think startles us is not always a threat, right? Sometimes it's a loud noise that we hear that startles us, and that initiates a fight or flight response. Now, the brain is very expert. It looks around, it doesn't see a threat, and then it can dampen that signal. However, in today's modern society, we have so many triggers that are coming at us through our five senses that our body can perceive as threats. Whether it is a traffic jam and we're late for work, the bus is running late, or the weather is scary, there's a hurricane coming, or work-related stress, family-related stress, or an illness of some kind. Or they can also be toxins coming into our bodies through the environment. All of these things can be interpreted by our body as a threat. And so what is happening today in our modern society is that so many things are coming at us that our brain misunderstands as a threat. And because it can't really distinguish, it's always preparing for the worst, right? Our brain's function is to keep us safe. It will prefer to scare us so that we respond rather than relax us so that we're not vigilant against a potential threat. And so this sets up this vicious circle of chronic stress, which is not something we're supposed to experience. This is something that we have unfortunately adapted to experiencing for months, years, decades. And this is what's causing adrenal fatigue and consequently burnout situations. And because burnout is such a slippery slope to chronic diseases, it proceeds to diabetes, high blood pressure, Alzheimer's dementia, cancer, autoimmune conditions, and other things. And so cortisol is the main hormone that is used to continue to manage these ongoing chronic stressors that we have in our bodies. And the body can do this to some extent, right? And this is where we see the first stage of adrenal stress, where cortisol is just always high. And we have these spikes of our cortisol when we're not supposed to have them, or our cortisol overspike. So if you look at what your cortisol is supposed to do throughout one single day, when you first wake up in the morning and light hits your eyes, you're supposed to have a cortisol spike. So cortisol is not just something that handles threats, it also wakes us up in the morning. It gets the body prepared for the metabolic activity it's about to undergo. When you open your eyes and light hits your eyes, that's a signal for your body to spike cortisol in the morning. And that spike of cortisol wakes up your thyroid, it wakes up your ovaries, it wakes up your gastrointestinal system, it wakes up your brain, it wakes up all of the systems that we need to have functioning throughout the day. And then it goes back to sleep. So when the adrenal system is done waking everybody up, it goes back to bed. So we see this big spike in the morning. By lunchtime, it's super low again, and then it peters out the rest of the day. That's a normal, what we call diurnal cortisol curve. Now, adrenal stress occurs when the cortisol spikes way ahead or above of what it's supposed to do. And we get this excessive cortisol in the morning. Or throughout the rest of the day, what we see is that the system doesn't reset itself back down to the low levels of cortisol it's supposed to, but instead the cortisol remains higher than it should be, either at various points throughout the day or at all points throughout the day. That's adrenal stress. So adrenal stress can result in people feeling anxious all the time, but they do feel very focused when their cortisol is high. So that's kind of the difference between someone who is burnt out from adrenal fatigue, which we'll talk about in a minute, versus someone who has adrenal stress. The person with adrenal stress, their cortisol's too high, feels like, yeah, I feel stressed, but I can take on the world. I don't care, right? They don't necessarily feel exhausted. They don't necessarily feel unable to focus. They feel a little bit hyper though. You can kind of tell they're a little hyper all the time. They're the ones that need to move around a lot. So they would be the ones that would fall into an excess dynamic metabolic type category, whether it be hot excess, cold excess, or temperature neutral excess. Those are the ones that usually have that high cortisol, either at 1 or 2 points throughout the day or all points throughout the day that we check for this. That's how you can kind of tell without testing if you're going to be the one that has the high cortisol and be in the adrenal stress category. That's the early stage of an adrenal dysfunction. Again, you will not see this in blood work. If you get your blood work checked, your cortisol will be normal, completely normal. And we'll talk about why in a minute. But the gold standard to check for this is actually saliva. So your spit tells you whether or not you have adrenal stress much more accurately than blood work. The reason for this is because the saliva reflects more of what's going on inside of your cells. And it's the inside of the cells that are getting lambasted by the cortisol that's triggering the fight or flight responses, right? In order for you to have a fight or flight response, your cells have to have the cortisol available to them and not necessarily the bloodstream. Now, yes, granted, the cortisol has to travel through the bloodstream, but your body is always keeping cortisol in the bloodstream just in case, right? You won't see that if you're not in fight or flight that your cortisol is too low and that there's no cortisol in your blood. There's always cortisol in your blood. It's simply that it won't be spiked too high, even if you have adrenal stress. So your body knows, I better have cortisol ready and available at all times. But what happens is it's inside of the adrenal system that we get to see if that system is producing excessive amounts of cortisol because it feels that it needs to because there's too much chronic stress coming into the system. The best way to determine that based on studies, and this is the gold standard to diagnose adrenal stress, is to do a saliva profile where you're capturing your cortisol levels at 4 points throughout one day. So you capture it within 30 minutes of waking up. Then you capture it again when it should be coming back down into the low normal ranges where it should live throughout the rest of the day. And so you catch it at about lunchtime and then again around 4 p.m. and then again for the last time at 8 p.m. That reflects the activity in the adrenal system. And the way to capture that is again with saliva. We will not see this with blood work. Another important hormone that's made by the adrenal system to manage your stress is DHEA. We touch on this a lot in the podcasts, but we're going to talk about it a lot today, dive a lot deeper into DHEA and why it's important, and how we use it to diagnose adrenal fatigue. DHEA stands for dihydroepiandrosterone, and we call it the anti-stress or the anti-aging hormone because it helps to normalize what cortisol does. So cortisol will get you ready for a fight or flight response and carry you through that fight or flight response. And so what it does, it raises your blood sugar because you need energy to have a fight or flight response, although you don't use a lot of oxygen when you're running away from a tiger or a bear, really under an actual life-threatening threat. It will raise your blood pressure because you need to maintain your blood pressure to bolt out of there or fight. And also will do the same with your heart rate. You need to pump more blood around because again, that cortisol needs to get where it needs to go very quickly. This is what cortisol generally does, and it also makes you very alert. So people hyper-focus when they're stressed. And this is why they don't feel burnt out, because they're able to really hyper focus. When the cortisol levels are high and you're having adrenal stress, DHEA is usually normal. So DHEA is not usually overmade. It's not a hormone that we see too much of typically. Some circumstances where we see too much DHEA is if you're having an issue breaking it down in the liver. So people that have a congested or sluggish liver, or who are missing nutrients to break down their DHEA once it's been used, we tend to see that it will accumulate, and occasionally we'll see a high DHEA level. Or sometimes if someone is supplementing with DHEA and they're taking too much, then we'll see the DHEA levels up high. But typically your body is not overproducing DHEA in the same way that it can overproduce cortisol. So we will typically see this hormone level to be normal in the saliva, whereas the cortisol levels are high. So this allows the DHEA to run after the cortisol and clean up the mess of the stress. So this is why we call it the anti-aging or the anti-stress hormone, because what it does is it will normalize your blood sugar once the body perceives itself now to be safe or no longer under threat. So now it wants to bring your blood sugar back down to normal. It wants to bring your blood pressure back down to normal, and it wants to bring your heart rate back down to normal. So it allows you to adapt and recover from the stress in that way. It also helps you to calm yourself down. So DHEA is a very grounding hormone. So cortisol, I tell my clients, is kind of like the leaves of a tree just flapping in the wind, whereas DHEA is more like the roots of the tree that grow down deep into the earth and spread out to give that tree stability and to ground it. That's what DHEA does essentially in your body. And cortisol is literally kind of that bull in the china shop. It's the leaves flapping in the wind, running around handling the stress. This is the relationship between cortisol and DHEA that's important to know. Now, if chronic stress continues, like it's relentlessly ongoing for years usually, what we begin to see as one of the very first signs that someone is starting to have adrenal fatigue rather than just adrenal stress is that the DHEA starts to drop. So the body becomes incapable of keeping up with this demand of constantly having to make this hormone to keep the lid from blowing off from stress, to keep the bull in the china shop from completely destroying everything. The body has to keep pumping out the DHEA to keep normalizing everything and to keep everything in check. But if the demand is placed on the system to such an extent that the body runs out of the ability to keep up with that, again, you get a supply and demand mismatch with your DHEA, the DHEA starts to decline. The cortisol will not decline at first. So normally what we'll see is the cortisol still stays high, and the DHA is kind of falling in the normal range. So it's not too low yet, but it's less than it was last year, for example, right? So if we checked you last year, we may have seen your DHA was totally normal, cortisol was super high. And then now we check again a year later, we see that DHA is a little less normal, but still normal, but the cortisol is still too high. That's the first sign that you're running out of resources. And then if we continue to allow that stress to move through the system unabated, we continue to see the DHEA just keep dropping and dropping and dropping as the cortisol still stays high. But eventually, what happens is as the DHEA really starts to drop, we start to see that it's now too low. And then what we might see with the cortisol is that it's starting to drop, which is a very dangerous sign. And usually what happens is we get this false sense of security. If we don't understand the adrenal system, we'll see that the cortisol looks normal. So because it was so high and now it's dropping, it's now in the normal range, but it's not normal. It means that that system is not able to keep up with the cortisol demand, especially if you have a lot of symptoms related to stress, especially if you are still under stress. That's a big warning sign that the system is starting to not be able to keep up. And believe me, your body does not want that to happen. Your body will go to all lengths to preserve cortisol because it knows that if that fails, you're going to die. So it will do whatever it can to maintain those levels as normal as it can. But if the stress is too much, again, unrelenting, too chronic, then there's nothing the body can really do And then we see the cortisol continue to drop and drop and drop. Now, this doesn't happen quickly. It's not like we're going to check you in January and your cortisol is normal, and then in March it's too low. This takes a while. It can take years to happen and evolve. But meanwhile, you feel horrible, right? You're starting to really feel the impact of having your DHEA be too low and your cortisol not being able to keep up with the demand. I tell people it's better to have high cortisol than normal cortisol if you're under a lot of stress. And that sounds really counterintuitive, but the thing is, if you're under stress, the normal response for your body is to make too much cortisol. It is to spike your cortisol so that you can handle that stress. So if all your body is doing is making just enough cortisol, that's a warning sign, especially if you're not doing anything actively to buffer and protect your adrenal system. Now, if you're taking adaptogens and you're taking things that will systematically lower your cortisol, then we expect it to drop into the normal range. That's different. But if you're not on any support for the adrenal system and we're seeing your cortisol dropping, that's a major, major warning sign, a big, big red flag. And again, you will never see this in the blood work. And often the DHA is also normal in the blood work. Saliva is a more sensitive test to look at the endocrine system and the glandular system where those hormones are actually being made. When we look at blood work, what we're seeing is what those glands have released into the bloodstream and what's being transported from one system to another system. But we don't see what's available in the system to be used on a cellular level. And that's where stress is handled. Stress is handled in your cells. It's not handled in the bloodstream necessarily. Even for the maintenance of your blood pressure, there are cells that are managing that. It's not the cortisol in the bloodstream that's taking care of that by itself. And so it's always about the cells. It's about the interior of the cells. And so when we're looking for things like this, we have to look inside the cells for the answers because the bloodstream will not tell us about this. So someone in adrenal stress can feel, again, stressed, anxious. They may have sleep difficulties because cortisol wants to keep you awake, alert. And so they will often say that they have insomnia. And they will respond very well to things like melatonin, phosphatidylserine, or ashwagandha, because these types of adaptogens and supplements will bring cortisol levels down, allowing that individual then to sleep more soundly and to fall asleep more readily. Once you enter these kind of early stages of adrenal fatigue, you may still have trouble sleeping. However, the difference is you'll still feel anxious, you'll still feel stressed, but you start to feel like you can't handle it quite as well. So now the brain fog might be settling in a bit. You're getting that afternoon fatigue. You're okay in the morning, but then as the day wears on, you're not feeling so great. But it's not horrible, so you're not alarmed by it. You might write it off and say, well, yeah, I haven't been sleeping well and I'm stressed out at work and whatever the case may be, and just kind of keep putting it aside and normalizing it. And that's dangerous. That's where you want to really seek attention. And many people do seek attention. I have clients who have asked their primary care physicians to check their adrenals. However, they end up doing it with blood work and they're told that everything's fine. And then when we check with saliva, we see that no, you have adrenal fatigue, or at least the beginning stages of adrenal fatigue. These are the subtle differences that distinguish someone in adrenal stress who's crossing over into the adrenal fatigue, where that system can't quite keep up anymore. They're the ones that feel like, yeah, I could probably take a nap, but I can't. I have to keep moving. And they'll be able to push their way through and still get all the things they need to get done, but they'll feel it. Now, again, if that continues on, right? So if the stress keeps raging on and there are no extended breaks from the stress, and I'm not talking about just going on vacation or taking a couple months off. I'm talking about consistently being able to handle stress differently. If that's not happening, then the condition progresses into full-on adrenal fatigue. Adrenal fatigue is where now your DHA is already too low, now your cortisol is too low as well. So this isn't a complete failure of the system, but it's pretty close. Now, so there is a condition called Addison's disease where the system completely fails and now you can't handle any stress. and in fact, stress is life-threatening to you. One of our former presidents, John Fitzgerald Kennedy, had Addison's disease. And in order to maintain life in these people, if they are under excessive stress, for example, undergoing a surgical procedure, they have to be given steroids in order to endure the stress of the surgery, or they can die from the stress. And so that's a very fringe condition that occurs in 1% or less of the population, and that you will find in blood work. So when it's so severe that the whole system has just completely crashed, you'll see it in blood work. And that's when it's an actual life-threatening condition. Other than that, you won't see it in the bloodstream. So there are conditions where the system is like at 10% capacity. It's not at zero, but it's at 10%, 20% capacity. But the cortisol level at 20% capacity is going to be too low. The DHEA level is going to be too low, but your blood work will still look pretty good. It'll look normal. And again, that will be very deceptive because you'll feel like you're just exhausted all the time. You'll feel like you just cannot handle stress anymore. If you don't take a nap, you can't make it through your day. You want to go find a rock to crawl under because you can't handle the stress. You don't want to talk to anyone. You don't want to be perturbed in any way. That's the difference between adrenal stress and adrenal fatigue. Adrenal fatigue is, yeah, I'm stressed, I'm anxious, but I can take on the world. Come at me and I'll show you. The one with adrenal fatigue is different. The one with adrenal fatigue is like, I don't want to talk to anyone. I can't handle stress anymore. I'm just going to go hide over here and hope nobody bothers me. That person can still have insomnia. That person can still have tremendous anxiety. The difference is they feel like the anxiety never stops. They feel like they don't recover. Once something throws them off, they stay thrown off for days. Like they can't like quickly recover like the person with adrenal stress can. And that's another big hallmark of adrenal fatigue. And again, now here what's happening with the tree analogy is the leaves are wilting off the tree and the roots are rotting, right? And so the tree just falls over when it's under stress. There's nothing to keep it upright. And that's adrenal fatigue. And again, your blood work will be normal. So don't look for your DHEA to be too low in your blood work. Don't look for your cortisol levels to be too low in your blood work. That does not happen. So this is again something that has to be looked at with saliva testing. And we will very clearly see that at one of the points of the four that are collected for cortisol, the most important point is the morning spike. If you don't see that morning spike, or if you don't have a morning spike, that's very, very dangerous. It can lead to many, many chronic conditions because stress, again, is a cause of disease. So Harvard University and now other institutions are confirming this, that 95% of conditions are stress related. The reason that they become stress related is because now you can't handle the stress. And that's a big portion of it. So in many clients who have cancer, when we check their adrenal system, we see that they have severe adrenal fatigue. Again, not Addison's disease, we're not going to see that. We see adrenal fatigue. So everything looks okay in their blood work, but yet they have cancer and they're very sick and they may or may not respond to chemotherapy. Why? Because they don't have an adrenal system to help them respond to chemotherapy. The adrenal system manages your immune system. It manages your ability not just to handle stress, but it also manages so many other systems in your body. Your adrenal system is the root of the thyroid. And so if the adrenal system is out to lunch and not functioning, this is the cause of a lot of thyroid conditions. And it's not the thyroid system itself that's failing. It's very often the adrenal system that's not properly supporting it. Whether your cortisol is too high or too low, that's a problem. But it's a much bigger problem if your cortisol is too low. So if you have to pick a problem, pick the too high cortisol, not the too low cortisol. But of course, we don't always have control over that, but that's the preferable way to have an adrenal problem, is to have it be too high. The adrenal system also very much controls the reproductive system. So a lot of menstrual disorders are also due to adrenal issues. A lot of infertility is due to adrenal issues. We even see our clients get pregnant right after we start them on some DHEA and progesterone. We'll talk about progesterone a little bit later, but it's also used in stress management in that it is stolen to make cortisol. And so, very often, infertility or menstrual abnormalities are due to low progesterone, but that's because there's an issue going on in the adrenal system where it's not supporting the production of progesterone because it's too busy stealing it. So we'll often see that people get pregnant very quickly after we do this. I just spoke to one of my clients yesterday whose son is now 9 years old, but when she came in to see me almost 10 years ago now, she was really struggling to get pregnant. And we very quickly diagnosed that she had adrenal fatigue and that her DHEA was too low, her progesterone was being siphoned off, and the body was not wanting to get pregnant because it thought that it was constantly under threat. I think about 2 months after we started her on her hormone therapy, she got pregnant. She was um, thrilled and terrified at the same time because she was so prepared for it to be such a long haul for her to get pregnant that she was shocked when she got pregnant in 2 months. And so we still literally joke about that to this day when she has her follow-up. So her son was off to sports practice yesterday, and it's always shocking to hear that someone that you helped get pregnant now has a 9-year-old son. It's always really fun to see what these kids are up to and what they're doing in the world. We just joke around about it all the time whenever we talk. But she's not the only one. There are many others in that boat too. We counsel people that we're going to start them on these types of hormones. We counsel them that it's going to increase your fertility. So very often I have people get confused that when they take progesterone, it's going to be like a birth control type of situation. And so we have to be very careful to warn people that no, this is actually the opposite of birth control. And so the reason for that is because we use natural hormones. The reason birth control is because the hormones are artificial and they're in huge doses. And so you're tricking your body into thinking you're pregnant with these artificial hormones that are really hard to break down by the liver. So they accumulate in your body, tricking your body into thinking it's pregnant. And this is how it prevents fertility. Natural progesterone is not that way. Your body will take it, use it, and then break it down within hours. And so we use natural progesterone to help restore body function. One of those body functions, if you're of reproductive age, is to reproduce. And so that's the difference. So adrenal fatigue is a very common cause of infertility or even miscarriages. They're in such adrenal fatigue that the body is really not capable of holding on to and nurturing a pregnancy yet. Those are the people that have the deficient dynamic metabolic types, whether they be cold, hot, or temperature neutral. We do our best to strongly caution them to wait, to really actually build up the reserve so that the next time they get pregnant, they will be able to then carry that pregnancy to hopefully term. And using progesterone to maintain the pregnancy is often recommended if your progesterone levels are too low. Adrenal fatigue can be a cause of miscarriage. And this is now being recognized by mainstream medicine, not as an adrenal condition, but as a progesterone lack. There are medications that we can prescribe, trinone is one, where you use that vaginally for the first 12 weeks of a pregnancy to maintain the pregnancy until the placenta takes over, which will then make all the estrogen and progesterone for the pregnancy, and then we withdraw that. Clients that we measure progesterone levels in, again, very often the blood work will seem normal, even though the cellular levels of progesterone are too low. And for those clients, I still recommend that they take progesterone for the first 12 weeks of their pregnancy. Of course, natural progesterone, so that it's mimicking the progesterone that they themselves are making. So low progesterone is often a sign of either adrenal stress or fatigue. Adrenal stress because you need extra cortisol, so progesterone is being stolen to keep the cortisol supply going. But as you're running out of the progesterone, because remember also that adrenal stress suppresses the ovaries. And so you don't have the ovaries present continuing to pump out that progesterone. And so eventually you run out of the progesterone and now you're missing the precursor that you need to make the cortisol. And this is what causes the cortisol to start to drop in those clients. Mainstream medicine recognizes the idea that the progesterone's too low, but they're still not linking it to the adrenal fatigue situation that's going on. So these are all the things that can happen to younger clients who have adrenal stress and adrenal fatigue. If this adrenal fatigue is not addressed, and again, we'll talk about how to treat these three stages a little bit later on in the podcast, but if again, it's still not recognized, then these people start to get sick. They start to have high cholesterol, their blood sugar regulation's off. They may even have high blood pressure at a young age. They have mental health disorders, depression, anxiety. Cortisol maintains your mood as well. So does progesterone and estrogen and many other hormones, testosterone, DHEA, thyroid. They're all intricately involved in maintaining mood. There's no one hormone we can point to and say, this is the mood controller, this is the blood sugar controller. We often say, yes, insulin is what takes sugar out of your bloodstream, but it's being regulated by other hormones in the background. It's this big, huge symphony of things. Multiple hormones are involved in this very delicate balance that allows us to have our normal body function. So if we cut it off at the knees by having an adrenal disorder that remains undiagnosed, those other systems can't thrive, they can't function properly, and they just start to kind of cave in. Your immune system's not functioning, so now cancer can develop. People can have frequent and chronic infections, allergies, sleep disorders. The list goes on and on from adrenal conditions. And again, you'll read about these similar symptoms with people who have other conditions. Autoimmune conditions tend to present very similarly. Thyroid conditions present very similarly. And that's because A, there's overlap in hormone function, but B, they're all controlled by the adrenal system as well. And so you're going to have symptoms common to the adrenal system, common to all the other conditions that stem from an adrenal condition. But you have to keep digging and going down to the furthest roots you can get to and treat the foundational system. The foundational system is the adrenal system. And so this is why a lot of people, again, they'll come to me with their thyroid. They're on medication, but they feel horrible. Their blood work looks great, but they feel terrible. This is because they have an adrenal condition. So once we identify that and we put them on the correct supplements for their adrenal disorder, and we replace DHEA if it's missing and progesterone if it's been worn out, whatever needs to be done to rebalance their hormones, they feel much better. In fact, I just had a young client come back for a follow-up. It wasn't even time for her to follow up on her hormone replacement. We were following up on something else. She also has SIBO. So we were following up on the SIBO treatment protocol that I had prescribed for her. But as an aside, she said to me, like, are these supplements supposed to work this fast? She had just started her adrenal supplements and her DHEA just 2 weeks before. And she said, I feel really good. Like, is it just in my head, or is what you're doing actually really working that fast? And it really can work that fast, right? If we guess the right dose, if we make a really good educated guess as to how much DHEA that individual might require, and we hit the nail on the head, that person will feel better as soon as their DHEA level's back to normal. And the same thing with the adrenal supplements. If we're using the correct adrenal supplements, then yes, that system will be very quickly supported, and it will then support the rest of the body function. And so, yes, you can feel better in as little as 2 weeks with the proper adrenal supplements on board. And so she was thrilled because she was expecting to have to wait months to feel better. So she was a little bit incredulous that it was even possible. Yes, it's very possible. And then we can contrast that to a family member of hers who had just an introductory call. So we do discovery calls at the office so that people can tell us what they're looking for and how we can support them, and we can make sure that it's a good fit. So he's not yet an established client, but he told me, like, yeah, everybody tells me about this DHEA and I've taken it and I don't feel any better, right? And it's not just taking the DHEA. You have to know whether or not you need it. You have to also have the right dose. And you have to also have the proper support of the adrenal system in place. And so if you're just taking DHEA in a vacuum, then yes, we don't expect it to work. Yeah, briefly explain that to him so he had an understanding of, yeah, it's not necessarily that the DHA isn't going to work and that you don't need it, but we need to assure that you need it first. And then we need to know, like, what dose is going to work for you. And we also need to know what else to do to support the system nutritionally, in terms of lifestyle modifications, sleep, exercise, getting rid of toxins. All the four pillars have to be addressed so that the adrenal system is properly supported, and also the proper hormone replacement if it's necessary, and the proper supplements. And so this is a common reason why people will use adrenal supplements but not feel better. Another factor is if you're absorbing the supplements, which again, we talk about ad nauseum on the podcast, but it's so important. If you're not absorbing, you're not going to feel better no matter what you're putting in your mouth. These are all factors that need to be evaluated as a possible reason why you're not feeling better, despite doing the things that you feel would be right. So modern day stress is evolving, right? So we have newer generations. They're doing things differently than older generations. That's just how life works, right? Every generation brings in new things. Gen Z and Millennials are heading in a great direction in terms of their mindset and their awareness of holistic strategies. They're aware that they need to manage their stress. They're aware that they need to sleep, eat better, exercise. They have full awareness. In fact, they're the best educated generations, and yet they're the most burnt out generations. They're the ones with the most adrenal fatigue. And again, we've talked about this before. They're being born into a very toxic environment. Our social structures are falling apart right now. They haven't been doing so hot even before right now. So they were born into a culture where, yeah, this idea that I'm just going to get a vocation under my belt, go to school, work for the same company, get my pension, and retire, the days are long gone, right? So they were born into like the hustle culture. They were born into having side gigs and not having benefits and a cushion to rely on. And so they're having to figure all these things out on their own. They're also the digital generations, right? So the digital fatigue, like the doom scrolling, and if you're not careful with your algorithm, right, what you're being fed and what's coming in as data into your brain. That's really critical because your brain can't tell the difference between what's on a screen and what it's actually experiencing in real life. This has caused a lot of stress for Gen Z, millennials, and now Gen Alpha, who's growing up with computer screens and phone screens as well. And then now this idea of working remotely and not having boundaries between when I'm at work and when I'm not at work. And then again, the hustle culture and the side gigs. And so there aren't work hours anymore. And we're finding that the lack of structured work hours actually causes more burnout. We thought the flexibility would be good for people, but we're finding out very quickly it's not good. Like you have to have like a set number of hours, or this is me at work, and then the rest of it is this is me not at work. We have to have these very distinct boundaries. Slowly but surely, they're beginning to realize this, but the problem they're experiencing is they're caught in this burnout trap. It becomes a very vicious circle very, very quickly once you've gone down that slippery slope where you're out of the adrenal stress. Now you're heading into the adrenal stress and fatigue stage, and then the adrenal fatigue stage. It's a slippery slope, and it has so much momentum that it's just snowballs, and they can't even get out of their own way. Again, through no fault of their own, simply because when they go to the doctor, we don't recognize saliva as standard of care, and so we don't do it. Mainstream doctors, I have my two hats on. I have my mainstream doctor hat as an OBGYN, and then I have my holistic hat as a functional and Eastern medicine practitioner. Again, this blood work is just not going to show it. Now, they'll have some little things here and there. They might see that their vitamin D levels are low, for example, and have random iron deficiencies despite not having heavy menstrual cycles. There'll be little clues. They might have like a low white blood cell count all of a sudden. Their blood sugar might not be as wonderful as they want. Their cholesterol might be creeping up. There will be signs, but there will be no proof as to what's causing it in the bloodstream. And so this is again where saliva testing is so important. And a functional integrative medical doctor is your best resource to have an adrenal stress profile done. Now, bear in mind that the adrenal stress profile is going to measure the 4 points of cortisol and DHEA, but it's not going to measure progesterone, which is another really key hormone. So you do need a full saliva panel that's going to measure estrogen, progesterone, testosterone, DHEA, and the 4 points of cortisol. Then we're going to have a really good picture around your adrenal system and what stage of adrenal dysfunction that you have. Now, someone who's in full-blown adrenal fatigue is going to be the one who feels dizzy when they're standing up or sitting up from having laid down. they have to get up really slow, or if they get up, they get woozy and they have to kind of brace themselves. They might be diagnosed with something called POTS syndrome, which again, I don't like that diagnosis because it's a vital sign and not a diagnosis. It's a sign that you're not able to maintain your blood pressure, and that's usually due to an adrenal condition at least, plus or minus a gastrointestinal condition where you're not absorbing food. And so between those two things, you're not able to maintain your blood pressure and you feel dizzy all the time. And then they'll experience the brain fog. They can't remember things. They feel that they have no resiliency against the stress, like they're exhausted all the time. And they may be, again, tired and wired. Despite being exhausted, as soon as they lay down, they literally can't turn off their brain. The person with adrenal stress can't turn off their brain because their cortisol is too high. The person with adrenal fatigue can't turn off their brain because there's no DHEA to help them turn it off. So again, DHA is what kind of quiets you down, re-regulates your breathing so that you're not hyperventilating and stress breathing or what we call shallow breathing. It helps to slow down your heart rate and get things back to ground level, so to speak. When that's not present, people feel like they just can't turn it off. Like it won't stop, and yet they're exhausted. The person with adrenal stress isn't exhausted. They don't care. It's the person with adrenal fatigue who's really just tired. So again, we have this flawed idea that if I just go on a vacation, if I change my job, everything will get better, right? Yes, of course, resting is important, but if it's not a consistent rest, that's not just 2 weeks packed into a short, brief period of time, it has to be extended where you're doing that most nights. You're getting enough sleep most nights. You literally have to buy extra sleep to recover. So the idea that we can't catch up on our sleep is really flawed. It's not really true. It has to be something we do very consistently for months to even years. So the idea of staying up super late and then getting 5 hours of sleep and then running and moving on to the next thing will only work when you're in the adrenal stress stage. Soon as you start slipping down into the stress fatigue and then into the fatigue, you will not be able to do that anymore. When people feel like I can take on the world and I'm just going to do this stuff and get it all done, you're on borrowed time. So you're wearing out the reserve tank of the body in the form of the cortisol and the DHA that's available, and you're outpacing it. So you're taking up all of its reserve, and then when it starts to run out, you're going to hit a brick wall if you're not careful. So this is why you don't want to be running on all your cylinders all the time. You have to actually sleep at least at bare minimum 7 hours if you're a biological male, 8 hours if you're a biological female. That's just to maintain status quo. If you've already slipped into a stress fatigue mix and or a fatigue picture, you have to add an hour of sleep to that. So again, if you're a biological female, now you're looking at 9 hours of sleep a night. If you're a biological male, you're looking at 8 hours of sleep a night. And again, if you can't sleep, you want to fix that. You want to really look at, why am I not sleeping? Could potentially be because your cortisol is too high at night. I know that there's a lot of controversy about melatonin because most people don't get tested to know if they actually need melatonin or not, and they take it. And that could be very detrimental if you have low cortisol. So if you're in an adrenal fatigue state and you take melatonin, it's going to wipe you out. It's going to make you feel worse. Those are the people that feel hungover on melatonin and groggy. Yes, it's supposed to help you fall asleep, but it's not supposed to completely knock you out and then you're trying to wake up the next morning and you're groggy and dizzy and feel hungover. It's not supposed to have that kind of an effect. That's typically because that person didn't need the melatonin because their cortisol at night was either normal or too low. So you want to be very, very cautious and have your levels checked so that yeah, I'm using the right supplement and I'm not harming myself. And so melatonin is appropriate for people that have high night cortisol levels. Progesterone may also be very helpful if you're having trouble staying asleep at night. So again, having your levels measured and knowing exactly what it is that you need is of great benefit. Saliva is the most sensitive way to test for these things. Using slow release progesterone, this has to be made for you. It's not something that you find at a regular pharmacy. So it's a bioidentical progesterone that's compounded and made for you at various doses depending on your requirements. It's a slow release because we want it to sit in the gastrointestinal system and we don't want the progesterone absorbed. When it sits in the gastrointestinal system, bioidentical progesterone will be converted to GABA. GABA is a neurotransmitter that helps us to stay asleep. So people that wake up frequently may not have enough progesterone to convert to GABA. So in addition to being converted to cortisol, it also converted into GABA. And it also balances estrogen. So progesterone is a very busy hormone with a lot of side hustles. So it can get burnt out too and not be there when you need it. So replacing it is really important. What's important to know about slow release progesterone is it's not going to be there to balance estrogen. So it's not something that you can usually take as a standalone hormone that will help with estrogen dominance. So very often, if someone needs the progesterone for sleep, we will prescribe it for sleep as a slow release, but also prescribe a different form of progesterone that can be absorbed into the body so that it can be available to balance estrogen, which is another really important function of progesterone, among the many others that it has. If your cortisol is consistently too high, ashwagandha or combinations of adaptogens can be very helpful. Ashwagandha has been studied and shown to be very good for helping to reduce the feeling of stress. The reason for that is because it drops cortisol. It doesn't normalize cortisol, it drops it. So again, you want to be very careful that you know that your cortisol is too high before you take ashwagandha. Because if your cortisol is normal, it's going to drop it and make it too low. This is why we see some reports of toxicity with these standalone herbs, because you don't want to make assumptions, right? You can feel stressed and have your cortisol level be too high or too low or normal, because stress can be due to other hormones being off kilter. Like if your DHEA is too low, but your cortisol is normal, you're still going to feel stressed because DHEA is that grounding, relaxing hormone. So it's not always cortisol that's making you feel stressed and anxious. So another really important reason to make sure you're being tested. So ashwagandha, rhodiola, and similar types of what we call adaptogens. Phosphatidylserine is another amino acid that is used to, again, drop cortisol. I'm not going to say normalize because it's not a normalization per se, it's a dropping. If your cortisol levels are not too high, if they're normal, it will potentially make your cortisol levels too low and backfire. And so what normalizes cortisol is actually the DHEA rebalancing and also your breath. Your breath normalizes cortisol. So taking deep breaths, again, the HeartMath quick coherence technique is a really good way to normalize cortisol. So it's not going to drop your cortisol too low. It's just going to make sure that it gets renormalized. And that's the difference. One thing I want to add about the progesterone slow release, every once in a while, it backfires. So remember that progesterone is used to make cortisol. So we call that cortisol steal. So while progesterone is supposed to convert to GABA, that's going to help you relax and stay asleep. If you're too stressed out and you don't have your adrenal system being properly buffered in other ways, that progesterone can be stolen and made into cortisol and actually make you feel worse. I had that happen to an acquaintance that I recently met. And when she found out I was an integrative medical doctor, she's like, "Can I ask you a question?" And she had been started on progesterone, and she was feeling extremely anxious on her progesterone. And I asked her, I said, "Is it oral progesterone?" And she said yes. And I said, "Well, that's probably the issue." And I asked her, like, "Were your adrenals also tested before you were prescribed the progesterone?" And she said no. And I said, "Well, that's probably the issue. You probably have an adrenal issue going on, and the progesterone is being stolen and being made into cortisol." And so she said, "Yeah, I got to talk to my nurse practitioner about that." And then a week later, she said, "Yeah, I stopped the progesterone. I feel much better now." And these are the things, like, you don't want to treat in a vacuum, right? You want to be very careful that you're looking at things very holistically. Otherwise, things that are potentially very beneficial can be thought of as being detrimental. Then you might run into problems inside what we call side effects, although they're not really side effects. It's simply that something else is going on that needs to also be addressed. So when people have high cortisol levels, traditional Chinese medicine teaches us this, that we should never use a single herb for any extended period of time. I prefer to use cocktails of adaptogens as opposed to single adaptogens for that reason. Each of them works slightly differently to, again, bring that cortisol level back down. So we want to make sure that we're surrounding the adrenal system with proper support. And it's just safer to use a cocktail of different things, none of which are at tremendously high doses, so that they're all kind of playing their role and buffering the system in the most appropriate way. Now, if someone is in a mixed adrenal stress fatigue picture, the most likely thing that we're going to see there is, again, their DHEA is now dropping. May not be too low to have to be replaced. However, if it is too low, definitely want to replace that. And there are a couple different ways to replace DHEA. One is with just regular DHEA, again, always bioidentical. And there's another version of DHEA called 7-keto DHEA. The difference between those two forms of DHEA is that regular DHEA is interconvertible. It can be converted into testosterone or estrogen, and that's on purpose. In your own adrenal system, that also happens. So if the adrenal system needs to convert the DHEA into other hormones, it can. So when you take it externally as a supplement, the same thing can happen. And so you want to be very careful and know that if I'm replacing my DHEA, I'm also replacing my estrogen, and I'm also replacing my testosterone at the same time with that one pill. And it's really important that you're having all of those other hormones checked if you're taking regular DHEA. Because if you're overburdening your body and raising your estrogen levels above normal or your testosterone above normal, that's going to be very burdensome to your liver, and it could potentially fuel problems. Having estrogen dominance can be a significant problem over time. I can't emphasize the testing enough. It's really important. Now, if you have a history of breast cancer, or you don't want to take the risk of having the estrogen made from the DHEA, then you take it in the 7-keto DHEA form. And now it's in a form where it cannot go back and become estrogen. So it's a safe form of DHEA to take even if you've had estrogen sensitive cancers in the past. Always, when you're replacing hormones, you want to make sure that you're testing the levels of the hormones in your cells and also looking at how they're being broken down by your liver. You don't want your hormones to be improperly broken down into toxic form, because then they're going to backfire on you as well. So these are all important things to know when you're getting hormone replacement therapy and having your adrenal system supported. Another thing we'll see when someone's in adrenal stress and fatigue is that their cortisol might look normal. And again, I put that in air quotes on purpose because it's not really normal. Again, the way you tell is the DHA is low, but the cortisol is normal. And that's not a normal system. Sometimes we look at the cortisol curve and it looks pristine, but the DHA is too low. And so we know, okay, this person's in adrenal fatigue, no matter what story the adrenal system's trying to concoct to tell us it's normal. And so we learn this when we study the adrenals in integrative medicine, like to take a normal adrenal curve with a gigantic grain of salt, because usually it's not really normal. So you still want to protect the system under those circumstances. You don't want to use things that are going to just drop the cortisol. You want to also use things that will be supportive. So in the case of adrenal stress and fatigue, nutrients are really important. So there are certain vitamins that are critical for adrenal health. Vitamin C, most of the B vitamins, B5, B6, folic acid, the minerals magnesium, zinc, selenium, also vitamin E and vitamin A. Great foods that help support adrenal function are citrus fruits, green leafy veggies, cruciferous vegetables like broccoli, cauliflower, Brussels sprouts, high quality proteins like fish, various meats, again, as organic and clean as you can find them. Poultry, eggs, fish oil is another really important nutrient for adrenal health. So fatty fish like salmon, sardines, those are great. Nuts, seeds, dark chocolate, bell peppers, strawberries. These are all amazing foods to eat for general adrenal health to help support the adrenal system. There are specific herbs that can also be used for adrenal stress and fatigue, again, based on your results. And so always see a functional integrative medical doctor so that you can be prescribed the correct adrenal supplements. Because if you're not taking the correct adrenal supplements, they can backfire. The other thing to know as well is an adrenal supplement is not a permanent prescription. If you're on, for example, ashwagandha or something, a cocktail of adaptogens to bring that cortisol down, you don't want to keep taking that supplement Once your adrenals are normalized, right, you want to then switch over to have something that's just going to generally support as opposed to continuing to drop your cortisol. So you have to have your levels periodically checked at least every year or so to make sure that, yes, this is still the most appropriate supplement for me, and make sure that you have it switched up if you need to approach your adrenal system differently. Now, for adrenal fatigue, so now your DHA is low and your cortisol is low. Now that's a different treatment entirely, right? So for those people, they're full-blown burnt out. They're exhausted. They're dizzy. They just do not feel well. They're getting sick. They may have medical conditions being diagnosed. They may be on medications at this point. They need a whole different type of treatment. So again, sleep, so important. Naps, critically important for those people. Their diet really matters, like making sure to incorporate the foods that we talked about. Breath work, super important to build resiliency back up. They may need to take adrenal extracts so that we can help to stimulate the body to make its own cortisol. Or they may temporarily need actual cortisol replacement, bioidentical cortisol, so that we're replacing what their bodies cannot do while we're working with them to look at why they're in such a fatigued state. So in order for them not to feel dizzy, in order for them not to have the consistent brain fog, exhaustion, in order to support their thyroid function, their adrenal system, for example, for fertility, we often need to replace that cortisol if the body is not able to make the cortisol despite the support that we provide. Cortisol is not prednisone. It's not, solumedrol that can be prescribed, for example, when you have an autoimmune condition or a bad cold and we want to very rapidly suppress inflammation. So this is very different. So with prednisone and solumedrol and things like that, we can see weight gain, loss of sugar regulation, high blood pressure, and other conditions occur. With cortisol, we do not see that. So cortisol is a bioidentical hormone, whereas those other things are artificial and they're very strong. So prednisone is 40 times stronger than cortisol. Basically, when you use prednisone, you're taking a sledgehammer to the adrenal system. Cortisol replacement is not that. What we're doing is we are providing the function back to the body that the system cannot do. So we're mimicking the body function until such time as the body can recover. So we're not suppressing the adrenal system, we're enhancing their function. Clients that have been prescribed prednisone for extended periods of time, we often see that once that prednisone is withdrawn, the adrenal system does not recover. We don't see the cortisol pop back up into the normal range. And for those people, we need to provide a lot of support. So the difference between adrenal extracts versus cortisol is the extracts, we don't get to control the dose. We're stimulating the body so that it can make the cortisol. So sometimes we can overstimulate the body, right? We don't have the control. So we have the control with the cortisol. We can very precisely dose that out. And then finally, some mindset prompts. So one is to set boundaries. If you're working from home, for example, set yourself work hours. Like, this is when I work. I work from here to here, and then I don't work beyond that, right? So if it's your 8 hours that you have to put in for the day, put in rest, right? Put in 15-minute rest periods during that 8 hours, and then of course make sure that you have your meal time scheduled in there. Set your phone if you have to remind you to breathe. Set your phone if you have to remind you to take that 15-minute break. You got to put yourself first, no matter how much pressure you're getting from anywhere on the outside. It's very counterintuitive. People feel like I have to pour myself into work, and then when I'm done, I get to take care of myself. You get to do both. Again, I encourage you to see an integrative functional medical doctor to get properly evaluated so that your adrenals are running on all cylinders. If you haven't yet taken our burnout assessment, it's brand new, it's ready to go. It's an interactive burnout assessment that will tell you exactly your dynamic metabolic type right there live. And then we'll send you a report that's personalized for you based on your dynamic metabolic type for your 4-pillar fix to get yourself out of burnout or to prevent it as well. Again, if you're interested in our corporate burnout recovery programs, connect with me on LinkedIn. I'll be happy to share our corporate burnout risk assessment tool and provide you with a customized report for your company. And if you got value from today's podcast, I ask you to please like, share, and subscribe so that we can continue to bring this valuable content to you. And stay tuned. It's May, so we're going to be coming up with our burnout prevention challenge later on this month for our YouTube subscribers and our email subscribers only. So if you haven't subscribed to our channel and you want to participate in our challenge, please subscribe so that you don't miss out. So as always, thank you so much for listening. And until next time, many, many blessings.